This is a recording of Dr. Tom Roselle Live for Sunday, January 23rd, 2011. You can listen to Dr. Tom Roselle Live every Sunday from noon to 1 p.m. right here on 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle, and I am live in studio right here at 888-630-WMAL. That's 888-630-9625. Perhaps you've had a problem, you've tried, you've applied, you've come up with the same old, nothing that's really worked. Well, maybe I can put a different light on the subject for you, something that might lead you in a new direction, meaning fix it. We can get it done. You know, your health is all in your hands. It is truly a do-it-yourself program, by the way, which many of you know is the title of my new book, Ageless Health 101, Health is a Do-It-Yourself Program. But the point of the issue is that anything that's going on in your life truly is up to you. It's the decisions, it's the places you've been, the things that you've done, sometimes on purpose, sometimes not so much, but you end up where you're ending up. And the good news is that your body's extremely forgiving and it'll turn yourself around. That's why we try to present a perspective without drugs, without surgery. 888-630-9625. We have a special guest in studio today with me. We're going to talk about a topic that is burgeoning in the integrative care community, one that is thousands of years old, one that is part of our practice and one that we incorporate with much of what we do and as a primary focus point, and also one that is supportive in all the other things that we get done. And what I'm talking about is acupuncture. Acupuncture originated in China and also in the Asian area. We also have the argument that acupuncture may have started in India, but let's take it from a traditional Chinese medicine point of view. And we have an expert. We have one of my staff members, doctor of naturopathy, and a licensed acupuncturist, Dr. Stephanie Pina. Welcome. Good afternoon.
Good afternoon. Thank you for having me.
I'm glad that you're here. You're here because this coming Wednesday evening on the 26th of January at 7:30 p.m., you're going to be our host, our presenter for our in-house continuing education program, and we're going to be talking about acupuncture beyond the needle, meaning all those things that are part of traditional Chinese medicine, in addition to cooperative with, sometimes in place of, what people think of as acupuncture, meaning the insertion of very hair-like needles to move energetics, to move the flow of what we call qi. So, Dr. Pina, let's start out by talking basics, and we're going to kind of take this into applications. Our phone lines are already lighting up, and we're going to take those calls today. But if I ask you this question, the field of acupuncture is really not just acupuncture. The field of acupuncture really is the field of traditional Chinese medicine. Explain that.
Yeah, essentially a lot of people tend to know acupuncture and Chinese medicine only for the insertion of needles. And essentially there's a lot of other aspects of it that are becoming more and more popular, like using Chinese herbs, also using dietary therapy to help supplement how things are going with a certain disease and condition. Also the use of kind of tools and techniques that people can use, including cupping or moxibustion or heat therapy, all are combined together to basically help support the body system through a number of different ways and improve that qi and blood flow.
So let's back up and pull the string a little bit here, because we're talking about a concept that is so foreign to begin with, just the insertion of needles into the body. People like say, oh my God, nobody's going to put a needle in me. And the truth of it is those needles are so fine and so hair-like, they're, in most cases, you don't even feel them going in. But now we're talking about not only needle acupuncture, but we're talking about other modalities. First, what is it we're trying to affect? I think more importantly, we have to describe what it is that acupuncture, traditional Chinese medicine, is actually trying to affect in the body. What is that?
Essentially, it's trying to affect the body's immune system and also the body's ability to promote circulation and oxygen throughout the whole body. By doing that and promoting blood flow and energy flow and looking at it from an energetic standpoint, you're able to get to those tissues throughout the body that essentially are not getting blood flow and supply and they're not healing correctly. So overall, you're working on the body's immune system and ability to heal any kind of chronic and acute structure or damage that's going on.
But very differently than allopathic viewpoint, we're looking at the energy fields of the body, those things that allow everything to be interconnected, if you will, to other systems, for the heart to work with the lungs, the kidney with the bladder, and so forth. And there's an intelligence about that. And in traditional Chinese medicine, that intelligence is the energetics that binds everything. We call it qi. And so we know that needle acupuncture moves qi, and it'll act as like an antenna, and it takes it from one place to the other and so forth. So having said that, let's talk about, you said immune function, you said circulation, you said that what we're trying to do is increase the body's capacity. Describe that a little bit more, because there's so many people out there that I'm sure are sitting there saying, yeah, but what does that mean? So what does that mean?
Basically, it means that the body, like you say, is talking to itself all the time. There's all these different connections, whether we're talking about the nervous system, the cardiovascular system, bringing in oxygen. And essentially, acupuncture works by basically connecting one part from the other. If you can improve blood flow from the heart and it's circulating out to, say, a shoulder where you might have some pain, that's going to improve the body's ability to heal that area or to promote more blood flow to areas where there's more inflammation. From a traditional standpoint, when you look at it from Chinese medicine, the qi and the blood flow are energetic ways of kind of that connection. They didn't understand how the body worked. They couldn't say this is the nervous system. So essentially they would use observation to kind of see if we used an acupuncture needle or if we used a certain technique, the body responded. One area, if you used one area of the body to treat another area of the body, there was connection. So essentially, by improving the body's connection, it's able to talk to each other, it's able to communicate to each other, and it's able to help heal different areas of the body too.
Well, I know in China, the application of traditional Chinese medicine is very fundamental and is very different than what we do here in this country. In our practice, we utilize those tools. My eyes were open significantly some years back when Connie, who is one of our partners in the practice, came back, and she had done her internship in Guangzhou, China, and she was telling us about the different types of manual modes and manipulation that's part of traditional Chinese medicine. They call it twin eye, and as a chiropractor, we use heavy modes of manipulation, and osteopaths do the same thing. And she said it's very similar, but also very different. And also the herbal preparations that they use, acupuncture, needle acupuncture, without all those other things we're talking about, is just taking a piece of what is a huge, huge area of interest in application. So we know that we're trying to move energetics. We know that we're trying to move qi, as you say, and it affects blood supply, it affects the heart, it can affect the kidney, it can affect all the pieces of the body because it has an intelligence, a coordination to it. So now we're talking about things that support needle acupuncture, and in some situations, things that can use in replacement of acupuncture. And I know this Wednesday evening, the 27th or 26th of January, this coming Wednesday at 7:30 p.m., you're going to get into this in depth, and you're going to show people the application of traditional Chinese medicine using additional modalities. I don't want to say other modalities because they're not other modalities, they're additional. You mentioned cupping. What's cupping?
Cupping is essentially a pneumatic device. So essentially what it is it could be a jar. It used to be made out of glass and bamboo. There are also ceramic jars out there as well. But essentially it's placed over the body and it creates almost like a suction cup vacuum on the skin itself. By doing that, it's actually drawing more blood to the surface from underneath. So it can be really effective if you're treating kind of chronic, long-standing problems and conditions or soreness that are deep down that, say, you can't get to quite with the needle or you want to apply an acupuncture needle to later. So you can use it over flat surfaces of the body. And you can also actually use it in acute care cases to help remove fevers and stuff because you're bringing that blood to the surface, so it's helping relieve some of the heat through sweating. You know,
there's a lot of practitioners that will teach patients acupuncture pressure points and that you can hold them. And patient will always ask me, said, well, can't you just teach me how to do pressure points? And they do work, and there's advantages, but there's also limitations. What's that all about?
A lot of the limitations have to do with the fact that certain pressure points are going to be good for certain conditions. For example, there's one that's on the hand that's used often for relieving headaches. Well, it's going to be great if it's relieving certain kinds of headaches, especially tension headaches, because you're going to have tension in that muscle that's down in your hand, and thus you're kind of relieving some of the tension throughout your whole body. Again, it's about that connection. But essentially, if you're trying to treat something that's a little bit more internal, a little bit more chronic, you'd have to apply a lot of pressure over a lot of period of time and know exactly which points to use and most effective in order to relieve the best kind of relief. So that's where things like acupuncture and working with a practitioner is in your best interest, because essentially they're going to know how to treat you best and how your individual needs are different from someone else.
They also can teach you, and I know you do and we do in the office and Connie does, you teach patients how to help themselves. And when, as part of their care, but part of their acupuncture care, you're giving them homework, you're giving them things to do, but not only with pressure point therapies, but also with dietary changes and the like, which is significant and necessary when you're doing this. So Wednesday evening, 7:30. And by the way, I'm giving you the time, but if you'd like to join us and if you'd like to listen to Dr. Pina present this program on traditional Chinese medicine and the multiple modalities that are used in the field of acupuncture, give our office a call. It's 703-698-7117. That's 703-698-7117. Tell my staff that you'd like to attend and make sure that you make a reservation. As we've said before, these in-house continuing education programs that we do for your benefit are a courtesy, are a gift to the community, and we invite you. There is no charge, but we do request a reservation because we only have so many seats available in our classroom, and once they're filled, that's it. We can't take any more, and I'd hate to have you standing up against the wall for the entirety of the program. So 703-698-7117. Dr. Stephanie Pina, my guest, your host this Wednesday evening. We'll be talking about traditional Chinese medicine and talking about acupuncture, but specifically beyond the needle, meaning those things that are supportive of, cooperative of acupuncture. Dr. Pina, let's go to the phones before we continue. Jess, you've been holding a long time. Jess from Florida. How can I help you, sir?
Yeah, hi. I'm a firefighter, 60 years old. I've got 20 years in my second career, and this past 6 months to a year at some point in time, it may have been just the last few months because we've had a lot of tragedy and stress in the family. I've developed a blood pressure problem. The last couple of days of last week, it was 160. The first day, the first time it was taken, it was 170. They sent me to a full cardiac nuclear workup. I went through that, and everything is fine. My vasculature is fine. My heart's fine. But the doctor said that when I went in, it was still 160 systolic, and during the stress test where I had been inactive for several months on the treadmill, he said that it maxed out at 240. So I have a blood pressure problem that needs to be brought under control, and I wonder what the fastest, most
okay, so we've got about a minute before we have to break. So and I may hold you over, but let me say this first, and I'm going to have Dr. Pina talk to you as well. The blood pressure problem for anybody, if one has not had blood pressure problems and go through and suddenly goes through a situation like you've gone through with stress patterns and so forth, that's enough to jack it up. And you have to look at dietary patterns. You have to take away all the stresses: sugar, sodas, coffee, teas, fast food, fried foods, alcohol, gluten, preservatives, additives, things like that, as quickly as you can. Magnesium, particularly in the form of glycinate, magnesium glycinate, taking it up to start out with about 250 milligrams twice a day. If it doesn't give you bloating or diarrhea, take it up to 750. You keep adding until it gives you cramping, and then you start backing it down to where you don't have that, and you'll begin to bring it down. Sometimes just a basic vitamin B complex will help. Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. We are in studio at 888-630-9625. My guest, your host this Wednesday evening in our in-house continuing education program is Dr. Stephanie Pina. She's going to be talking about traditional Chinese medicine, acupuncture beyond the needle, those things that are supportive of, things that can help. We're talking to Jess, who called us from Florida. Jess, are you still there? Jess?
Yes, I am.
Okay, good. So let's talk about that blood pressure that's kicking up there after a whole bunch of stress in your life. And before the blood pressure got high, what was your blood pressure prior to that?
I don't remember an instance where it was higher than 139.
Okay, so, and what was the bottom? Do you remember? What was the diastolic pressure?
That was down around 85.
Okay, and when was the last time you remember it being at that level? How many months ago or when?
Oh, maybe 6 months ago.
All right, so this is all a recent situation. So what we're talking about is a stress-induced problem, and it can be the straw that broke the camel's back, with other problems already having been there. And it's just not a straight, simple thing. But you can use magnesium, you can use vitamin B complex, you can use an herbal flora essence called Rescue Remedy to try to dissipate the emotional piece. Having said that, let's talk about it from an acupuncture point of view.
Yeah, acupuncture can be really great for hypertension, especially if it's acute or chronic, but especially in your case, Jess, essentially what it would be doing is trying to treat some of that stress response. Your body's basically kind of increasing